1. A nurse is caring for a patient with heart failure who has severe dyspnea and pink frothy sputum. What is the priority nursing action? Answer. Administer oxygen and position the patient in high Fowler's position. Rationale. Pink frothy sputum is a sign of pulmonary edema, a medical emergency. Oxygen improves oxygenation, and positioning in high Fowler's reduces pulmonary congestion by promoting lung expansion. 2. A patient with unstable angina is prescribed nitroglycerin. What instructions should the nurse give regarding this medication? Answer. Take 1 tablet sublingually every 5 minutes, up to 3 doses, and seek emergency medical help if pain persists. Rationale. Nitroglycerin dilates coronary arteries, improving oxygen delivery. If pain persists after 3 doses, it may indicate myocardial infarction, requiring urgent intervention. 3. A nurse is caring for a patient with infective endocarditis. What assessment finding requires immediate intervention? Answer. Sudden onset of left-sided weakness and slurred speech. Rationale. These are signs of an embolic stroke, a possible complication of infective endocarditis due to vegetation embolization. Immediate intervention is needed to prevent permanent neurological damage. 4. A patient with atrial fibrillation is started on warfarin therapy. What should the nurse include in discharge teaching? Answer. Maintain consistent dietary intake of vitamin K and undergo regular INR monitoring. Rationale. Vitamin K affects warfarin's anticoagulant effects. Consistency prevents fluctuations in Indian rupees, reducing the risk of bleeding or clot formation. 5. A nurse is evaluating a patient post-cardiac catheterization. Which assessment finding requires immediate action? Answer. A rapidly growing hematoma at the catheter insertion site. Rationale. A hematoma at the insertion site may indicate bleeding or arterial rupture, which can lead to life-threatening complications if not addressed promptly. 6. A patient with a history of heart failure reports sudden weight gain of 5 pounds in 2 days. What is the most appropriate nursing intervention? Answer. Notify the healthcare provider immediately. Rationale. Rapid weight gain suggests fluid retention and worsening heart failure, requiring medical intervention to prevent pulmonary edema or cardiac decompensation. 7. A nurse is preparing to administer digoxin to a patient. What is the priority assessment before administration? Answer. Assess the patient's apical pulse for 1 full minute. Rationale. Digoxin slows heart rate, and administering it when the pulse is too low, typically less than 60 beats per minute, can lead to life-threatening bradycardia. 8. A patient recovering from a myocardial infarction, MI, expresses fear of engaging in physical activity. What is the nurse's best response? Answer. Engaging in prescribed cardiac rehabilitation can help improve heart function safely. Rationale. Cardiac rehabilitation is evidence-based and helps patients gradually regain strength while reducing the risk of further cardiac events. 9. A nurse is caring for a patient with pericarditis. What assessment finding is most concerning? Answer. Muffled heart sounds and jugular vein distension. Rationale. These are signs of cardiac tamponade, a medical emergency where fluid accumulation compresses the heart, impairing cardiac output. 10. A nurse is delegating tasks to an unlicensed assistive personnel, UAP, for a patient with heart failure. Which task is most appropriate? Answer. Assist the patient with repositioning in bed. Rationale. UAPs can assist with activities of daily living, but cannot perform assessments or administer medications. 11th. A patient with a deep vein thrombosis, DVT, is receiving heparin therapy. Which assessment finding requires immediate intervention? Answer. Sudden onset of dyspnea and chest pain. Rationale. These symptoms indicate a possible pulmonary embolism, a life-threatening complication of DVT that requires immediate medical intervention. 12th. A nurse is providing education to a patient with hypertension. Which statement indicates the need for further teaching? Answer. I can stop taking my medication once my blood pressure returns to normal. Rationale. Hypertension is a chronic condition requiring lifelong management. Stopping medication abruptly can cause rebound hypertension, increasing the risk of stroke and heart attack. 13. A nurse is caring for a patient with a history of coronary artery disease who reports chest pain. What is the first action the nurse should take? Answer. Assess the patient's pain characteristics and vital signs. Rationale. A focused assessment helps determine if the pain is cardiac-related and guides further interventions such as oxygen administration or nitroglycerin use. 14. A nurse is reviewing dietary instructions with a patient taking spironolactone. Which food should the patient avoid? Answer. Bananas and oranges. Rationale. Spironolactone is a potassium-sparing diuretic, and excessive potassium intake can lead to hyperkalemia, causing cardiac dysrhythmias. 15. A patient with heart failure is prescribed furosemide. Which laboratory value should the nurse monitor closely? Answer. Potassium level. Rationale. Furosemide is a loop diuretic that promotes potassium excretion, increasing the risk of hypokalemia, which can cause arrhythmias. 16. A nurse is assessing a patient with an abdominal aortic aneurysm, AAA. Which finding requires immediate action? Answer. Sudden onset of severe back or abdominal pain. Rationale. This may indicate an impending or actual rupture, which is a life-threatening emergency requiring immediate surgical intervention. 17. A patient is prescribed enalapril for hypertension. Which adverse effects should the nurse monitor for? Answer. Persistent dry cough. Rationale. Enalapril is an ACE inhibitor, and a common side effect is a dry cough due to increased bradykinin levels. 18. A nurse is providing discharge teaching to a patient with a newly implanted pacemaker. Which statement indicates a need for further teaching? Answer. I can use my microwave as long as I stand at least 6 feet away. Rationale. Microwaves do not interfere with pacemakers. However, patients should avoid close exposure to strong electromagnetic fields, such as MRI machines. 19. A patient is experiencing chest pain while walking. What should the nurse instruct the patient to do first? Answer. Stop walking and sit down immediately. Rationale. Rest reduces myocardial oxygen demand and can prevent worsening of ischemia. Further interventions can follow after stopping activity. 20. A nurse is preparing to administer a beta blocker to a patient with hypertension. What is the priority assessment before administration? Answer. Check the patient's blood pressure and heart rate. Rationale. Beta blockers lower both blood pressure and heart rate, and administering them to a hypotensive or bradycardic patient could cause dangerous cardiovascular complications. 21st. A patient with acute decompensated heart failure is receiving intravenous furosemide. What is the most important assessment after administration? Answer. Monitor for hypotension and electrolyte imbalances. Rationale. IV furosemide rapidly reduces fluid overload, but can cause hypotension, hypokalemia, and dehydration, requiring close monitoring. 22nd. A nurse is assessing a patient with chronic venous insufficiency. Which finding requires immediate intervention? Answer. Development of a deep, irregular wound on the medial ankle. Rationale. Venous ulcers indicate poor circulation and an increased risk for infection, requiring prompt wound care and management. 23rd. A nurse is reviewing lab results for a patient on atorvastatin therapy. Which result requires the nurse to notify the provider? Answer. Elevated liver enzymes. Rationale. Statins can cause hepatotoxicity, and elevated liver enzymes may indicate liver damage, requiring dosage adjustment or discontinuation. 24. A patient with dilated cardiomyopathy reports dizziness and near syncope when standing. What should the nurse do first? Answer. Assess blood pressure and heart rate in supine, sitting, and standing positions. Rationale. Orthostatic hypotension is common in cardiomyopathy, and monitoring blood pressure changes helps determine fluid status and cardiac function. 25. A patient with a history of rheumatic fever is admitted with new-onset dyspnea and a diastolic murmur. What condition does the nurse suspect? Answer. Mitral stenosis. Rationale: rheumatic fever can cause mitral valve scarring, leading to stenosis, which manifests as dyspnea and a diastolic murmur due to impaired left atrial emptying. 26. A nurse is caring for a patient with a hypertensive emergency. What is the priority nursing intervention? Answer: administer IV antihypertensive medication as prescribed. Rationale: a hypertensive emergency requires immediate blood pressure reduction with IV medications to prevent organ damage such as stroke, myocardial infarction, or renal failure. 27th. A patient with heart failure is prescribed a low-sodium diet. Which meal selection indicates proper understanding of the diet? Answer: grilled chicken with steamed vegetables and brown rice. Rationale: a low-sodium diet helps prevent fluid retention and exacerbation of heart failure symptoms. Processed and high-sodium foods should be avoided. 28th. A nurse is caring for a patient with a suspected abdominal aortic aneurysm, AAA. Which assessment finding is most concerning? Answer: a pulsating mass in the periumbilical area. Rationale: a pulsatile abdominal mass is a hallmark sign of RLA, which poses a risk of rupture, requiring urgent medical evaluation. 29th. A nurse is caring for a patient with an implantable cardioverter defibrillator, ICD. What instructions should the nurse include in discharge teaching? Answer: avoid placing a cell phone directly over the ICD. Rationale: electromagnetic interference from electronic devices can affect ICD function, so patients should keep cell phones at least 6 inches away from the device. 30. A patient with chronic stable angina is prescribed metoprolol. What is the expected therapeutic effect? Answer: decreased heart rate and myocardial oxygen demand. Rationale: beta blockers reduce heart rate and contractility, lowering myocardial oxygen consumption and preventing anginal episodes. 31st. A nurse is monitoring a patient post-coronary artery bypass graft, CABG surgery. Which assessment finding requires immediate intervention? Answer: chest tube drainage of 200 milliliters in 1 hour. Rationale: excessive chest tube drainage may indicate active bleeding, requiring immediate notification of the healthcare provider. 32nd. A patient with left-sided heart failure reports paroxysmal nocturnal dyspnea. What intervention can help alleviate symptoms? Answer: sleep with the head of the bed elevated. Rationale: elevating the head of the bed reduces pulmonary congestion and improves breathing by decreasing fluid accumulation in the lungs. 33rd. A patient is diagnosed with hypertrophic cardiomyopathy. What activity restriction should the nurse include in patient education? Answer: avoid strenuous exercise in competitive sports. Rationale: hypertrophic cardiomyopathy increases the risk of sudden cardiac death with high-intensity exercise due to abnormal ventricular contractions. 34th. A nurse is evaluating a patient with Raynaud's phenomenon. What statement by the patient indicates a need for further education? Answer: I will take my decongestant medication for a cold if needed. Rationale: decongestants contain vasoconstrictive agents that can worsen Raynaud's symptoms, leading to reduced blood flow to extremities. 35. A patient with a mechanical heart valve is prescribed warfarin. What is the target Indian rupee range for this patient? Answer: 2.5 to 3.5. Rationale: patients with mechanical heart valves require a higher INR range to prevent thromboembolism while minimizing bleeding risk. 36. A patient with an ST elevation myocardial infarction, STEMI, is scheduled for percutaneous coronary intervention, PCI. What pre-procedure intervention is most important? Answer: ensure the patient has received dual antiplatelet therapy. Rationale: antiplatelet agents, aspirin and AP2Y12 inhibitor, reduce the risk of thrombotic complications during PCI, improving outcomes. 37th. A nurse is caring for a patient receiving amiodarone therapy for ventricular arrhythmias. What adverse effects should the nurse monitor for? Answer: pulmonary toxicity. Rationale: Amiodarone can cause pulmonary fibrosis, presenting as cough and dyspnea, which can be life-threatening if untreated. 38th, a nurse is educating a patient with peripheral artery disease, PAD. Which statement indicates effective learning? Answer: I will dangle my legs when sitting to improve circulation. Rationale: in PAD, keeping the legs dependent promotes arterial blood flow and reduces ischemic pain, whereas elevating the legs can worsen symptoms. 39th, a patient with a recent myocardial infarction is prescribed clopidogrel. What instructions should the nurse include? Answer: avoid using NSAIDs and report signs of bleeding. Rationale: clopidogrel is an antiplatelet drug that increases bleeding risk, and NSAIDs can further increase this risk by inhibiting platelet function. 40. A nurse is assessing a patient with cardiogenic shock. What is the most concerning finding? Answer: cold, clammy skin and a systolic blood pressure of 80 millimeters of mercury. Rationale: cardiogenic shock results in severe hypoperfusion, leading to hypotension and poor tissue oxygenation, requiring immediate intervention to prevent organ failure.
If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying.